Aftercare is a crucial part of the PMU service. Yes, your technician is responsible for the outcome while you're on the table, but once you leave, it's actually your responsibility to follow the aftercare practices to keep the beautiful outcome. And in this video, we're going to delve into some cases of clients who didn't take it seriously and why you shouldn't make those same mistakes. My name is Elena Besman from Cosmopolitan Academy. You may have seen me on the TV show Legacy Makers or in one of the many publications globally. As a multi-certified global trainer, I've been helping artists just like you learn the best techniques and pro tips to become successful in the beauty industry. What I'm about to show you is completely avoidable. So listen to your poor PMU artist. She isn't joking when she tells you to follow the aftercare and that it is important to follow the steps that she gives you. Don't stress if you missed any of this because we can send it to you in our free 8-week PMU bootcamp with this info and additional content to scale your business in the description link below. Okay, so let's delve into the two major complications if you are not following your aftercare. I mean, of course, you're going to have poor retention, things like that, but two that are really, really important and kind of scary and super gross is if you're not cleaning them properly, taking care of them, contaminating them with bacteria, then there's two major infections that would truly affect you, okay? The rest can all be fixed. But these two things is infections and then inflammatory complications from poor aftercare. These are the two big ones that you want to look out for while you are in the process of healing up. So the first 2 weeks, this is according to PMU Hub, which we all know and love. So poor aftercare, they even put it right on their site. It's the first 2 weeks that is really, really, really crucial. So when they're talking about microblading, but this is for any PMU service. Okay, so to remember to clean them regularly and remove bacteria, as well as oils and ointment buildup, and applying a new thin layer of your cleansing ointment, pre-care ointment, I should say. Okay, so how to recognize if your PMU has had infection. So normal swelling and redness, totally normal, mild tenderness, and some scabbing. What is not normal though? If you are not following properly and this turns into an actual infection for you, swelling, extreme redness, and early signs of an infection, green, yellow, or brown, usually thick discharge, and odor coming from the area as well. When the eyelids, when you're doing eyeliner, swelling that spreads in that area too. So if you get your eyeliner done, it starts to spread, or from the brows down, if you're getting permanent makeup somewhere else and it starts to spread into this area, this is a very serious infection. You need to see a doctor right away. Okay, and then fever as well. This is obviously incredibly abnormal. This is an infection. This would definitely need to seek medical attention, and quite frankly, shouldn't have been left this long before seeking medical attention. You can see the pus, the bacteria, the discharge that is now dried and crusty. The color is not normal scabbing. Okay, you can see the yellow and the green. That would indicate major infection. So during your healing process, aftercare, for your PMU sessions, okay, very common for all types of PMU, and of course your PMU artist is going to have additional content for you to follow. So this is just as a generalization, but follow everything that your PMU artist gives you directly. So basics, keep the area clean. Avoid touching or scratching, okay? Because this can introduce bacteria into the opened wounds. And then apply your aftercare ointment and cream, and avoid sun exposure and water contact. This can actually burn the area while it's healing in the first 10 days, and quite frankly, up to about 6 weeks. Follow the aftercare provided we just talked about that. Okay, so these are the very, very basics. And if we're not following this, I want to just show you some swelling. This is considered completely normal. See this puffy in here? You can see almost the lymph sitting underneath the area. That is totally normal. That is totally okay. What is not normal with excessive swelling is when it goes down into your neck, into your throat, and you have breathing problems. This would no longer be considered swelling and normal. This would be a good indication of an allergic reaction and you need to seek medical attention ASAP. Even call 911 if it's restricting breathing. That is not normal, and that can happen not from the PMU per se, but from an allergic reaction from either the pigments or the needles used in the skin. So that is another thing to look out for. If you see this swelling, totally normal, totally okay. Sleep elevated, use some ice that is covered and sterile, and the rest, unless it's affecting your breathing, this is normal within your aftercare procedure. Let's quickly recap when your aftercare has gone wrong and when to seek medical attention, because if you catch some of these issues early on, it will actually help the outcome tremendously. Number 1, infection. Number 2, excessive swelling that causes breathing problems could be an allergic reaction, so definitely seek medical attention if it's excessive and it's restricting airflow. If you like this video as much as I love making it, then don't forget to subscribe, like our video, and send us some love in the comment section as your appreciation for your view. Don't forget to take our free 8-week boot camp in the description link below. And if you want to see the inside scoop on the opposite topic, don't forget to watch our next video on why pre-care is so important prior to any PMU service. I'll see you in the next video.